I should offer a little bit of contextual background, I suppose. Not just about the Healthy Kids Collaborative, but how we arrive at this day. The lawsuit was filed in 1999. I came into office in 2003, shortly after a verdict could not be found by a previous jury, and I set out in discussions in good faith with all parties to that. Ultimately, I reached an agreement with DuPont whereby they would donate substantial monies to particular categories that would be distributed directly to the problem here in Rhode Island. When that happened, I reached out and to assemble the largest cross-section of people that cared about the issue to ask for their help, advice, guidance in applying those funds. And we started to do just that. Over time, I guess I look back today at December 2007, we assembled over at St. Joseph's Hospital and talked about the distribution of $1.2 million over 2 years for outreach and education, grants that went to 6 community-based organizations across the state, including Blackstone Valley Community Action Program, Childhood Lead Action Project, East Bay Community Action Program, Thunder Mist, St. Joseph's Health Services, and West Bay. They began implementing their programs in February 2008 after finalizing the work. At the end of the first year of the grant agreements, more than 40%, or $526,000, had been expended directly on outreach and education, which is so very, very important in this ongoing effort. During the first year, 4 of the grantees instituted statewide case management programs, providing assistance to 182 families here in Rhode Island of children whose blood levels were lower than the state action level, but still needed that education and outreach. One grantee is providing case management services for a family with a child with lead levels as well. Other programs include partnerships with community-based organizations to ensure the availability of information on lead safety programs statewide, distribution of literature, landlord classes, health fairs, home visits, and outreach to pregnant and parenting teens, all with a focus on education and awareness, so that we can literally protect kids' lives and make families healthier. Grantees have also expanded the availability of free 3-hour training programs on lead-safe remediation for realtors and property owners seeking a Rhode Island certificate of conformance. In the first year, 196 realtors and property owners attended one of those classes. In August 2008, the Healthy Kids Collaborative launched a lead-safe home remediation pilot project where we assembled in partnership with the West Elmwood Housing Development Corp. in Clearcourt, Rhode Island. The project made 2 housing units in one building lead-safe and marked the completion of the first HKC lead-safe property. This pilot project then served as the model for us to turn to for the full remediation program, which begins today, as well as provided valuable lessons learned for all of us. On August 18th, the Children's Health Forum and I provided a site tour of the pilot unit and announced that HKC had issued a request for proposals for a lead-safe remediation program that would bring up to 600 Rhode Island housing units in targeted communities to the current federal and state standards for lead safety. The launching of the remediation phase of the program represented HKC's second major initiative and served as a milestone in marking Rhode Island as a model lead-safe community. The target areas that have been chosen for remediation include 3 areas in Providence, 1 in Pawtucket, 1 in Central Falls, and 1 in Woonsocket. They are all located in low-income neighborhoods with a concentration of families living below federal income guidelines, and where there are a high number of children with elevated blood levels, large number of families with children under the age of 6 years old, and large numbers of pre-1950 housing stock. These areas were selected with data provided by the Brown Medical School. I know Dr. Vivier is here on behalf of the Brown Medical School. Is invaluable in so many different ways during certainly the build up to trial, the resources, but certainly getting us through this and working in collaboration. Doctor, you have my thanks and Rhode Island's thanks for what you've done to help us identify these homes in this process. On December 17, 2008, the Children's Health Forum, HKC and I announced that ClearCore USA had been selected to perform the lead remediation work with an award of $6.7 million. ClearCore is working in partnership with West Elmwood Housing Development Corporation, Realty Endeavors for Affordable Community Housing, or AKA REACH, Childhood Lead Action Project, Blackstone Valley Community Action Program, and ClearCore, Rhode Island, to implement the program. An outreach plan is recruiting eligible property owners for remediation based upon program priorities. And HKC is working with the grantee to develop protocols for recruitment. The first round of funding was provided to ClearCore USA in February of 2009, and ClearCore and its partners have just completed the first quarter of work. One example of HKC's capabilities in the community came in December when one outreach and education grantee alerted us to a situation where a young couple had purchased a fixer-upper home and were conducting renovations in anticipation of the birth of a child a few months later. Unfortunately, the couple had limited knowledge of lead-safe work practices, and the woman was found, sadly, to have an elevated blood lead level. The couple vacated the home, and HKC and ClearCore USA began working with the couple to provide assistance with lead-safe remediation as part of the 600-unit program. Though the newborn had tested with a blood level, elevated blood level, HKC was able to prevent further lead exposure for the family. While this project has been challenging, it provides an opportunity for HKC to demonstrate the ability to assist homeowners on programs intended to ensure the child will be moved into a lead-safe environment. As HKC enters the second year, we are monitoring the outreach and education grants and determining priorities for year 3, as well as considering a possible media campaign and enforcement component. HKC continues to work with a variety of statewide partners, including not only my office, but local HUD programs in Woonsocket, Providence, and Warwick, Rhode Island Housing, the Housing Resource Commission, and other nonprofits. Most importantly, we will continue to develop and implement systems to oversee lead-safe remediation work and ensure the program is successful not only this year, but in the years ahead.